Is the next pandemic lurking again in China? Hey everyone! Welcome back to our channel. In today's episode, we're diving into a pressing health concern emerging from China. A new wave of pneumonia cases that's been catching the attention of experts worldwide. A significant increase in pneumonia-like cases, predominantly among children in northern China, has raised concerns. Memories of the initial phase of the COVID pandemic resurface, given the similarities in the situation, including overwhelmed pediatric hospitals. Notably, facilities in Beijing and Liaoning are facing a high influx of sick children, leading to school closures and overcapacity issues at Beijing Children's Hospital. The World Health Organization, seeking clarity, requested details from China on November 22 regarding this rise in illness. Chinese health officials attributed the outbreak to various respiratory pathogens. This raises questions about the nature of these pathogens and whether they pose a threat of becoming a pandemic. Let's explore these concerns further. Mycoplasma. One is a bacteria, Micoplasma, which has been causing outbreaks of respiratory illness in China since June this year. Mycoplasma is usually treated in the community with antibiotics, and hospitalization is not common. It can lead to a phenomenon called walking pneumonia, which is when the chest X-ray looks much worse than the patient appears. In Taiwan, however, reports have suggested there's a high level of antibiotic resistance to Mycoplasma, which may explain why it's causing more hospital admissions. Influenza. Influenza fell to very low levels during the first 2 years of the COVID pandemic due to masks, physical distancing, and other measures. But once things began to return to normal, flu infections tended to bounce back. Influenza is most severe in children under age 5 and the elderly, so may be contributing to hospitalizations among children. RSV and Adenovirus. Respiratory syncytial virus can also be severe in children and, like influenza, all but disappeared during the first 2 years of the pandemic. But it's now circulating widely. Adenovirus, which can cause a range of syndromes including gastroenteritis and a flu-like illness, has also been reported as contributing to the current outbreak in China. There are reports of children vomiting and pictures of children receiving IV fluids, presumably for dehydration as a result of gastroenteritis. The role of COVID. SARS-CoV-2, the virus that causes COVID, can also cause pneumonia, but less so in children. Early in the pandemic, we knew SARS-CoV-2 could show pneumonia on a chest scan in asymptomatic children, so COVID-2 can cause walking pneumonia in kids. SARS-CoV-2 causes more deaths in children than influenza, so likely is contributing to the overcrowding seen in hospitals. Some research suggests SARS-CoV-2 may also result in immune dysfunction after the infection, which may explain the unexpected rise of other infections, including streptococcal infections and Mycoplasma, since the pandemic. Co-infections. People can become infected with SARS-CoV-2 and other bacteria or viruses at the same time, which may also explain the severity of the current epidemic. One study showed co-infection with SARS-CoV-2 and Mycoplasma is very common and results in more serious complications. Could it be a new pandemic? The below figure shows reports of outbreaks of unspecified influenza-like illness and pneumonia, together with known causes influenza A and B, SARS-CoV-2, RSV, pertussis, adenovirus, and Mycoplasma. It confirms an increase in respiratory illnesses this year in China compared to the same time last year. If no known cause for this surge had been identified, that would give us greater cause for concern. But several have been identified, which gives us confidence we are not dealing with a novel virus. The virus we are most worried about with pandemic potential is avian influenza, which may mutate to become easily transmissible in humans. China has been an epicenter of avian flu in the past, but the spread of H5N1 has shifted to the Americas, Europe, and Africa. Still, this year, China has reported multiple human cases of various avian flu strains, including H3N8, H5N1, H5N6, and H9N2. With large and continual outbreaks in birds and mammals, there is a greater likelihood of mutations and mixing of bird and human influenza genetic material, which could lead to a new pandemic influenza virus. The threat of new viruses is increasing, and pandemic potential is greatest for viruses spread by the respiratory route and which are severe enough to cause pneumonia. There is no indication that the current situation in China is a new pandemic, but we should always identify and pay attention to undiagnosed pneumonia clusters. Early warning systems give us the best chance of preventing the next pandemic. And that wraps up our discussion for today, folks. But before you go, let's not forget the serious topic we touched upon earlier, the emerging cases of pneumonia in China. It's a situation that's evolving quickly, and we encourage everyone to stay informed and cautious. If you found this information helpful, don't forget to hit that like button and subscribe to our channel for more updates and insights. Your support helps us keep you informed on important health matters like this. Remember, health is wealth, and staying aware is the first step to staying safe. We'll continue to bring you the latest, so make sure to turn on notifications to not miss out on any crucial updates. You may also want to watch Today in History, tornado outbreak in US and Japan, land of shaking ground. Stay safe, stay informed, and take care of each other. Until next time, this is Innovatronics TV, signing off. Thank you for watching.